So I guess I can only blame myself because I'm on the planning committee, but usually planning committees give the person to close a little bit more of a break. A presentation, the one before the last one, that they can space out on and sit with their laptop and figure out what they're going to say. So I feel like Chris and Tony actually did a really nice job of doing some sum up, and so I'm going to plagiarize their presentations a little bit. And just add some final thoughts of my own and just take us back through the last day and a half. So I'm not going to show this because I don't want anybody to space out, but I just show it again because I think we saw over the last day and a half that there are a lot of different pathways, a lot of different communities, and that we learned that our ability to actually go out as spokes, go out radially in this diagram and really be able to model is at very different stages. I mean, I'm just going to say what we saw was a bit of a heterogeneous, confusing picture. So the image of a kaleidoscope as a summary is fitting in that way. And if people, I've had people come up to me and say, am I the only one that's confused in this room? And the answer is no. It's complicated. It's heterogeneous. There's a lot of different, even within some of these radial areas, there are different kinds of questions and different kinds of models that we've talked about. I started off here, of course, and I think we've proven this to be true. Of course, Tony kind of gave me the. As Tony does. Tony is one of those people that he is the master of this role, of the summation and of finding the wonderful quotations to just frame everything. And of course, Tony went and figured out that, well, maybe it wasn't Yogi Berra, that maybe it was Niels Bohr. And so I went, well, actually, Sam Goldwyn has been quoted as saying this, and Mark Twain's been quoted as saying this, and in fact, it's some anonymous Dane who was actually the very first cited person of having said. Most of these people were cited posthumously as having said this, which is quite a remarkable thing. So I guess I just had to come back to Tony and say you were right. I think he did say the thing about timing and hitting home runs, but I think we've proven this to be a theme of it. And then of course we had the John Muir quote about in talking about the need for systems thinking, the fact that everything is connected to everything, and we went back and forth a couple of times saying, well, yes, it is, therefore we have to use a systems approach. And then we said, well, but how, and then Chris came back and said, well, you can't model everything, you have to use a systems approach to be able to focus in. And she said, well, when you change that paradigm of thinking from a linear approach to a systems approach, there may be havoc and chaos ensuing. And I stole her picture to show that. And I think that's a little bit where we are right now and why some of the discussion was a little confusing. We're trying to change the paradigm of how we do risk modeling to apply a more systems approach, to bring in new teams and new ways of thinking that we haven't before. And we may find ourselves, on the wrong end of the street at times. We heard a bunch of new quotes that I thought I would just rehash because they brought up a number of different themes. We heard all environmental health is local, and then we heard a lot of pushback on that. And of course, it's because it's both true and not true. A lot of decisions that we make are at the local level, but a lot of decisions require cost-benefit analysis and other kinds of aggregation and integration that is anything but local. It's really large scale, and the question that we're dealing with, of course, is global. And so, we have to be careful about truisms, and this is one truism that we should probably be cautious about when we're talking about complex systems and global environmental health. I was going to sing this, but I chose not to, but we heard, where have all the demographers gone? Long time passing. We need them to come back wherever you are. Please come back, come back. I was really struck at a scenarios workshop a couple of months ago when I was told that the U.S. Census has stopped doing a lot of the projections they used to do. This is a big issue, and we didn't focus in on this, but I think that as we get to, and you'll see some of the other quotes, as we get to the issue of relevance, we can't be relevant without being based in demography and a solid understanding of what's going on with populations and demographics and socioeconomics. And so this is a piece that I think we have to be aware of. I mean, we don't have a solution, but I like this quote, 2100's a lot closer than it was when we all started this stuff. We talked about temporal scales, the short term and the long term, and we have to make 2100 a lot closer to a lot of people, I think, in order to start motivating the kinds of changes we need. And then we have to address the grandma issues, and I think this is getting at some of the issues that we just talked about on this last panel. We're talking, to get to the next level of this, to get to the kind of effort, resources, attention, et cetera, we got to be able to explain it to people's grandmas. If we can't do that, we're not going to make progress. So I saw this slide from Chris as well. She used it to give a visual to say that we have a lot of different answers, but we're really not sure about what the right questions are that we need to be answering. And this idea of really getting the decision framing, the decision context frame. All right, I'm decision. To get to the decision right, and to base our modeling in the most important decisions that have to be made, and to get to the decision makers and get their questions. But I'm going to pose the thought that after a day and a half, that we're not even quite sure that we do have the answers, that we have the certainty that we're doing things the right way. And so I think there is this chicken and egg that I just referred to, that we have to actually be able to show that our kind of modeling and bringing in climate health impacts actually is important to the decision makers before they'll sit down at the Jeopardy board and start pushing their button and giving us the questions. So I don't have a Niels Bohr quote, but I thought I would quote a disciple of Niels Bohr, who I'm kind of paraphrasing what he said. If we were particles, we might say this kind of thing. He said, it's impossible to know both the location and the momentum of a particle at the same time. So I've kind of taken it to our setting. It's hard to be able to describe. We've spent a day, really, getting to the state of the art of the modeling. I think we've done a really good job of that, of understanding where we are as a community, as well as can be done in this kind of limited time frame. But I'm not sure we know where we're going at the same time. I'm not sure we quite got there. I think that the last panel was really helpful. I think that there are follow-up discussions to be had. I think there is this chicken and egg issue of really having pilots and examples where we prove the value of what we're trying to do as ways to then be able to build a more robust forward set of plans. So these are just some thoughts that I've taken away. This is personal. This is not, I'm definitely not an agency set of recommendations, just as an individual, my personal thoughts. We didn't talk a lot about health co-benefits, but that wasn't the focus of this meeting. But I think it was Shari who said that, we've got all these integrated assessment models. They're specifically doing cost-benefit and mitigation policy, and we don't have health in those models, and that is a real low-hanging fruit, because when it comes to air pollution, that's some of our most solid risk assessment. The recommendation that I heard from this workshop is that one pathway is to recognizing that climate is only one among many stressors, is to just come out with that and say, we're really about integrated risk, we're about regional risk. Bob was saying this in this last panel. We have to kind of frame the question differently. It's not just about climate change, it's about how do we integrate global environmental change, social forces, non-climate drivers and climate drivers, and have our models, if we're going to integrate models, that's the questions that we're going to be answering. And I think we still have some work to do to figure out what are those questions that we're trying to answer when we do that. So there's a little bit of muddling there. In terms of the global picture and the health modeling at the global scale, I think we had some wonderful comments from Stefan Hallgatt and from Shari and from others about this need to be thinking about the two-way impacts of health as a factor in the context of poverty eradication and sustainable development and the sustainable development agenda, and to kind of work in that sense to, that there's a tremendous need to make sure that all of the investments that we're making in poverty eradication don't get undermined by unforeseen consequences of health from climate change and other changes, and vice versa, to ensure that the investments we're making are actually informed by adaptation. The domestic side, I think we heard about the need for more data sets to unlock some of the data that we already have and make it applicable in the modeling scene, and then especially refining the questions. And I think that the Climate and Health Program is one of the great, going to be one of the places collaborating with our partners in the UK, Canada, around the world, as we're all struggling with this, and we're all engaging the public health community and decision makers to further really define our decision context. Some of the critical gaps, I think that we've heard that there is a modeling community. There's a big health modeling community. One of the things I didn't mention is a very robust infectious disease modeling community. They don't look at any ecological drivers for the most part. Time to time they do a little bit. It's called NIEHS, and they're really focused on transmission dynamics, on vaccine interventions, other kinds of public health interventions, but not the instigation of epidemics. We have health policy modelers. There's lots of people modeling health policy. So there's this gap between the expertise in some of the sectoral modeling and then addressing these underlying environmental social drivers and moving into this area of predictive modeling for social factors. Another gap, we've talked about the use of models to assess interventions. We don't have a whole lot of examples where adaptation has been incorporated into the models at all. The only one I believe that I heard, well, Chris has done some work in the past on this, and the new WHO assessment has done that. We didn't hear the nuts and bolts of that. I think there's some nuts and bolts work of exactly how do you do that. Demography. And then this last, which is the issue that we came to, which is, how do we get how do we make the case as a scientific community to decision makers that they need to invest in long-term preventive strategy? Part of this is the time, this temporal issue, the fact that institutions aren't even around as long as we're talking about, let alone terms of political office, and how to tap into long-term thinking and move that forward. So that's all I had. I just want to thank again the organizers of this conference, and especially thank the staff of the National Academy, Marilee Shelton Davenport, Keegan Sawyer, who was really the catalyst of this, Lauren Soni, who made sure that everything worked. Thank them for their role in this workshop, and thank you all for staying with us, the wonderful contributions, and look forward to the next steps. So thank you.